Alrighty, so now we are moving along to the second part of this chapter in consciousness, and it is now dreams. So what we dream and why we dream. This is a very Freudian chapter. All right, so speaking of my good boy Freud, psychoanalysis and dreams. So that is Freud is the father of psychoanalysis. He proposed that dreams are this form of wish fulfillment. These are the things that you can't play out in like the real world. So these are actings out in your dreams. These are all of your unconscious desires that you can't perform or you can't do in real life. So we act these out in dreams. Especially these were kind of the sign of the times, because this era that Freud was in was the Victorian era, when women, were kind of hidden. They weren't showing their body. They weren't doing anything like that. So Freud's twisted way of thinking, especially with women, all had to do with this like sexual desire and your wishes and, being seen, not heard, per se. So he had two levels of content that he discussed, and it was the manifest content and latent, which are two things you need to know. So the manifest, just remember, that is the remembered storyline of the dream. And then the latent content, like latency, is kind of put on hold. That is the hidden meaning of a dream that you may not know in your conscious awareness, which is why it's that hidden form of the dream. All right, so here are some areas of the brain when we're looking at dreams, and what is active when you're in your REM sleep versus when you're in your awake state. So there's a high degree of similarity between thinking when we are awake and the cognitive activity of dreaming. There's a network of neurons essential for dreaming in areas of the limbic system and the forebrain. So if you are, as you can see in each chapter, there's a lot of brain components mentioned. So if you're really a cognitive person or a neuroscience person, you can take something from each chapter and relate it to, different areas of the brain. Okay, so he proposed that dreams are a form of wish fulfillment, or again, playing out of unconscious desires. Covered in the last slide, you've got the manifest and latent. Just remember again, the manifest is the remembered, and then the latent is the hidden. So your wish fulfillment, he suggested, dreams provide a psychic safety valve to discharge unacceptable feelings. So if you just think about that, these are things that when you're awake, you can't act out. You can't do this. So what our body tells us is that, okay, whatever happened during the day, I can't wrap my mind around it. I can't kind of, not what's the word I'm looking for. I don't want to say salvage, but it's when you are going on in your day and there are things in your day that maybe were distressing or whatever the case is, or there are things that you can't put that in words, then your body has this restorative factor that it will, according to Freud, basically dream it out. And then the purpose of dreaming it out is then so you can kind of recharge, get up the next day, and then everything is like status quo and it kind of starts again. So the dreams manifest, which is the apparent content, may also have symbolic meaning, latent content that signify our unacceptable feelings. So you will dream things, and they, like, for example, if you dream about somebody that you've never met before, these are people that you may have passed at a store, passed on the road, something, and they fulfill some symbolic meaning in your dream. So sometimes when you dream and you don't understand, you can also dream in symbols. So information processing dreams may help sift, sort, and fix days' experiences in our memories. So that is what I was saying before, that sometimes when you've had a rough day, your body kind of puts itself back in a reset mode and says, okay, what could you not handle during this day? Which is why, a lot of people do not remember their dreams, because they're just simply acting out these unacceptable feelings or things that maybe went wrong in your day. So now your body needs to just like put it back in check. And then according to the activation synthesis theory, this suggests that in the brain engages in a lot of neural activity that is random. Dreams make sense of this activity. So according to that theory, it basically just says that, okay, your brain is just misfiring all over the place. There's no rhyme or reason. You just dream. Most people lean more towards number 2, the information processing, that it's your body's way of just kind of accepting what happened during the day and then moving on. All right, so what do we dream? We dream negative emotional content, failure dreams, and sexual dreams. So negative emotional content, 8 out of 10 dreams have negative emotional content. That's pretty rough, but that's just, according to research studies, 8 out of 10 dreams are negative. Failure dreams, people commonly dream about failure, being attacked, pursued, rejected, or struck with misfortune. And this kind of makes sense going back in the earlier slide where, naturally, if you're, buying into the information processing model, that the reason that you're, the failure dreams, it's something in the day, so it could be symbolic, and so you're having to dream it out to go into the next day. And then sexual dreams, contrary to our thinking, sexual dreams are sparse. Not a lot of people actually have, major sexual dreams. But dreams in men are 1 in 10, and in women, 1 in 30. So 1 to 3, basically. All right, so how dreams work. Let's look at this. So this is a really cool website that I wanted to share with you, because I'm always getting questions about, what does our dream mean? What does this mean? What does that mean? So this website has a really good discussion on interpreting your dreams. And if you go down, if you look at, let me X out of that. If you look at the things that are hyperlinked, basically, that are in blue, you can click on those, and that's going to tell you what those mean. So I'm being chased. So if you're ever having a dream about being chased, click on this, and it's going to give you a description, frequency, the usual meaning, and then questions to ask yourself. So this is pretty cool because we all have those kind of dreams that are kind of in a loop that we dream about a lot. So that is pretty cool. You also have I'm injured, ill, or dying, car trouble, falling or drowning. A lot of people have that. Being naked in a public place. I've missed a boat or a plane. A phone or machine malfunctions. I'm in a natural or man-made disaster. Lost or trapped. I am being embraced or loved. I excel on a test or in a performance. Flying, swimming, dancing. I'm well dressed. Traveling happily. Phone or machine works perfectly. Experience natural beauty or miracles. I'm discovering new spaces. And then there's more information about how dreams work, how lucid dreaming works, is sleep that important, and how sleep works. So it's a pretty cool site. And then what about reoccurring dreams? I get that question a lot. Like, why do I keep having the same dream over and over and over again? So if you click on this, again, how stuff works, recurring dreams and nightmares. This is going to talk about your night terrors. And I think that is it on this one. Yeah. And if you go to the next page, it's just going to be something else. So this is just a little kind of snapshot into that. So I wanted to put that there for you because I like to try to answer questions that I get a lot of, answer the questions that I get asked. All right, so we're not collaborating. All right, so dream content, most feature ordinary everyday scenarios. Usually dreams are really not all that like, woo, which is why we don't really remember them. More likely to include sad events than happy ones. Again, a lot of that probably has to do with us kind of acting out the day's events. Relatively consistent across cultures. So, basically, if you're in a different culture, we all dream. So there's no like varying distinction in that. Dream duration, again, I've talked about this before. You want to know this. Average person starts dreaming about 90 minutes into sleep and then goes on to have about 4 to 6 dreams during the night. This goes based on if you have that kind of 7 to 7.5 hour sleep cycle, full sleep. Dreams seem to happen in real time. So they've done plenty of studies that they used to say that dreams happen in like, boom, a second. But now with EEG machines, EMG machines, EOG machines, we can see that dreams actually happen in real time. Lucid dreaming, super cool. It's not as popular as people think when people say, oh, I lucid dream. There's definitely an art to lucid dreaming, and it takes a lot of patience, a lot of time, and kind of a lot of like rehearsing for it. So you have to be in a very calm state to be able to do this. All right, so this goes on back to that vignette. We have another collaboration we skip. All right, so now we're going to get into psychoactive drugs because, of course, those affect your sleep and dreaming as well. So substances that cause changes in conscious experience includes caffeine, alcohol, nicotine, and prescription medication. They can all affect how you sleep, how you dream, and what you dream. So 3 major categories. You've got your depressants, your downers, and your stimulants or your uppers, and then your hallucinogens or your woo. Okay, so I start off with a picture. These are kind of effects when somebody is on meth, and it doesn't even have to be for a long time. If I remember correctly, this is a girl only on it for a few months. This is another. This, of course, these are pictures, and a lot of them don't distinguish other things. This is, I believe, a person that was on meth, and then there was an accident that was involved. So like a burn. Again, you can see from the marks, and a lot of these sometimes mixing with different drugs, they may look the same, like with cocaine and stuff. They could look with the sunken face here. This is kind of the evolving changes of women with meth. This, again, it's a lot of these facial scabby features. And by the way, that was her at 23 and then at 24. Lindsay Lohan, now we are on cocaine. We're on cocaine. It affects the teeth. If you look at her teeth right here, nice and white, then kind of yellowed out. Again, and if you notice too, if you look at the eyes, really kind of deadens the eyes. Same with here. This is Mishka Barton, I think her name is, actress. Looks like she got in a fight. Looks like she has a combination of cocaine and meth. Again, you'll notice with cocaine, also you're going to have this sunken kind of wrinkled face. See, same with her. Charlie Sheen, again, kind of the sunken face, messed up teeth. This is heroin. Heroin is, that's a doozy. This is an after before. So this was her kind of messed up, and this is her after. She got treatment. This was her before, before her recovery, and then after. So it's very possible to, have this kind of situation, and then you can recover from it. So it's not everybody is at a loss. Kind of not, you'll notice a lot like with her teeth, because it's really a mess up your teeth, and your skin turns very thin and wrinkly. And of course, Macaulay Culkin really had a rough time with heroin. All right, so moving to depressants. These are psychoactive drugs that depress or slow down the activity in your central nervous system. Some depressants include benzodiazepines. So in the benzo categories, you've got things like Versed, Valium, Xanax, Klonopin, Ativan is another one that I'm thinking of. Rufinol or Roofies, they're considered the date rape drug. Legally manufactured in other countries, but illegal in the U.S. Then you've got your barbiturates. Those are sedatives that have like a calming or sleep-induced effect. They're very addictive and extremely dangerous when taken in excess or mixing with other drugs or alcohol. This is a kind of gives you a visual of drug combinations and what it does to different communication systems in your brain. So this is your normal GABA activity, neurotransmitter. And then what happens with alcohol. And then when you mix alcohol and a barbiturate. Then you have your opioids. Those are the biggest issue. Those are your, what they call the most seductive drug. They minimize perceptions of pain, induces drowsiness and euphoria, slows breathing. Some are found in nature, morphine from the poppy plant, while others are synthesized like methadone that are made in the lab. A lot of times people will take opioids for depression, and that is because, you know, there's this physical pain, and sometimes when people are going through psychological pain, they also feel this physical pain and they just want to numb. And so opioids are kind of a go-to when people are suffering with a psychological depression. So about 2% of Americans age 12 and over have used heroin at some point. On average, in the U.S., approximately 192 people die from drug overdoses, and about 2/3 of these involve opioids. When we look at alcohol, that is also a depressant, most commonly used. You have binge drinking disorder, so consuming 4 or more drinks for women and 5 or more for men on one occasion or within a short span of time. It's linked to poor grades, low self-esteem, behavior problems in adolescence, and this can lead to death or accidental injury. So this gives you kind of like this is like an alcohol concentration chart. So the effects of a drink, a 12-ounce bottle of beer, 4-ounce glass of wine, or a shot of hard liquor vary depending on weight, ethnicity, gender, and other factors. So believe it or not, it does your ethnicity does play a factor when we look at evolutionary theory. Across most of the U.S., a blood alcohol content of 0.08 is the legal limit for driving. But even at lower levels, our coordination and focus may be impaired. So this kind of tells you what you can drink and over the span of time. All right, but some people report feeling high when they drink alcohol. How can that be true if alcohol is a depressant? When you take lower doses of a depressant, you can have this euphoric kind of high feeling. It's once you start abusing it or drinking more, then it then it goes into that depressant. So if you're doing something, especially for the first time or something you don't do often, then it gives you that kind of high euphoric feeling in the very beginning, but it changes and pretty quickly. So gender differences in metabolizing alcohol. The female body is less efficient at breaking it down. Women achieve higher blood alcohol levels, so a buzz, than men who have consumed equal amounts. And again, we look at body fat, body mass, things like that. Light alcohol consumption, like, having a glass of wine, may boost your cardiovascular health, which is why they say drinking a glass of red wine is good for health. But overuse of alcohol is linked to malnourishment, cirrhosis of the liver, Wernicke or Korsakoff syndrome, which is basically, it's called wet brain. They kind of like slur in their tone, and kind of their feet kind of drag. Heart disease, cancer, traffic deaths, and fetal alcohol syndrome. This is when the mother is drinking during pregnancy. Okay, so stimulants increase neural activity in the sympathetic nervous system, producing heightened alertness, energy, elevated mood, and other effects. Cocaine is illegal in the U.S., but popular recreational drug, produces a sense of energy and euphoria. It amplifies the effects of dopamine. The effects last only a few minutes to an hour, if, some people say if you're lucky, depending on how you administer it. Your amphetamines, those are also stimulants. Non-prescription use of methamphetamine is illegal. People have learned how to brew this drug in their own laboratories. There's lots of different labs. Chronic meth use causes serious brain damage in the frontal lobes and other areas, creating memory and movement problems. I've counseled a few people with meth addiction, heroin addiction. Very, very sad situation to see. I actually had a client who early 30s overdosed and died. And that was a tough one for me because he was kind of on the mend, but it's one of those addictions that really has a high relapse rate, just like alcohol has almost 100% relapse rate. And this one time he just, he took it to another level. Caffeine, also a stimulant, also considered a drug, blocks action of neurotransmitter that normally muffles activity of the excitatory neurons in your brain, makes person feel physically and mentally wired. Some people are not affected by caffeine, but most have a certain kind of rush to it. Moderate long-term consumption linked with lower rates of depression and suicide and reduced cognitive decline with aging. Tobacco is also a stimulant, causes most premature deaths in the United States. It's associated with a variety of ailments, including cancer, heart disease, stroke, lung disease, and kidney failure. Despite this, 15% of American adults smoke. There was a decline. Now I think it's back on the rise a little bit, especially with vaping. Nicotine sparks the release of epinephrine and norepinephrine. And then there's the dangers of secondhand smoke. I've known people that I've been close to that have died from secondhand smoke, never smoked a day in their life, but were around people that did, that were, very close to them. And so they ended up dying of secondhand smoke. Now we have the rise of e-cigarettes, all kinds of this new vaping stuff that we could totally get lost in because there was not enough studies. People thought, oh, it's much safer to vape. Turns out it is not at all. They're finding more stuff, water in the lungs, popcorn lung, all kinds of stuff. And there's just not enough. It hasn't been around long enough to really say that it's a safe alternative. I mean, does that look safe? I mean, that does not look. All that stuff just went in your body and now you're blowing that stuff out. Maybe people think it's cool, flavors and all that kind of stuff, but yeah, definitely not good for you. More kids are now smoking e-cigarettes in middle school, even elementary school. The use of smart drugs are on the rise. So non-medical use of substances, often dubbed smart drugs, to increase memory of concentration, known as pharmacological cognitive enhancement. The Global Drug Survey had almost 80,000 respondents in 2015 and almost 30,000 in 2017. U.S. respondents reported the highest rate of use. In 2017, nearly 30% said they had used drugs for PCE at least once in the preceding 12 months. But the largest increases were in Europe. Use in France rose from 3% in 2015 all the way to 16% in 2017. That's pretty significant. And then 5% to 23% in the UK. MDMA is another kind of crazy drug. It's known as ecstasy. It's been around for a while. It's a club drug. It's a stimulant and hallucinogenic. Has unusually sociability enhancing effects. So this drug is the one, like, the love drug, which, oh my gosh, your hair's so soft, you're so beautiful. It just has that kind of euphoric, feeling that everything is beautiful and wonderful. It triggers a sudden general uploading of serotonin, which is why the the feel-good neurotransmitters are kind of going through the roof, after which serotonin activity is temporarily depleted until its levels are restored. So it's kind of like that super big high of woo, and then just down until it's restored again. Researchers are exploring the potential therapeutic use of MDMA for people dealing with trauma. So they are doing studies and they're finding that hallucinogenics are actually effective for people with severe depression and trauma. So more and more studies are being done about those positive effects. Kids are loving that. Oh yeah, it's great. I'm supposed to be doing this. Marijuana, most widely used illegal drug in the U.S. I say widely used illegal drug now because eventually it will not be. Considered a Schedule I drug by the FDA. 33 states have now passed laws permitting its use for medical purposes. 10 states allow its recreational use. Comes from the hemp plant cannabis sativa. Contains tetrahydrocannabinol, or THC, easy way to say it, which alters pain and perception, induces mild euphoria, creates intense sensory experiences, and time distortion. So in a mild sense, some people are like a hallucinogen, but it does have a mild hallucinogen effect because there are hallucinogens in it. Okay, so again, another chart that shows you possible consequences of depressants, stimulants, and hallucinogens. So you can take a look at this on the still PowerPoint presentation, or just pause the video and look at this. All right, so overuse and dependence. Historically, the term addiction has been used to refer to urges people experience to use a drug or engage in an activity to such an extent that it interferes with their functioning or is dangerous. So can you be addicted to social media? The answer is yes, you can. Researchers are now putting this into the DSM, into the future DSM. It is going to be, we have internet gaming disorder. Don't know if they're going to come up with social media disorder. I think they're kind of toying around with different names. But research indicates the urge to resist media is harder to resist than sex, spending money, alcohol, coffee, or even cigarettes. And a lot of this has to do with your brain reward center. And we're finding that it is an immediate, it fixes, or what's the word I'm looking for? It satisfies immediacy. I want something, I get it now. I look at social media, I can see what's going on right now, or who posted what. And so more studies are showing that brains are actually decreasing in size because we are not using our brains more. And social media is, kind of one of the factors in that. You see people, they think of addiction as just physiological ones like substance abuse, things like that. But there is this psychological addiction. And a lot of times when people trade addictions for another, they might, stop drinking, but then they become attached to social media because it's like feeding something, because an addiction is more than just the actual thing that the person is doing. So more than the alcohol, more than the cigarettes, more than the sex. It's usually feeding into some other addiction. So they're looking at all of those, factors, but the APA does not consider behavioral addictions as psychological disorders yet. So you've got your physiological dependence and then your psychological dependence. So you can sometimes be psychologically dependent on something, but not physiologically, kind of like marijuana, unless it's laced with something. So you're physiological with constant use of some psychoactive drugs. The body no longer functions normally without the drug. So that's like being dope sick. So without it, you need it now. When you first started getting high, you first started drinking, it was like that euphoric feeling, that good feeling. But after you use it for so long, then your body needs it, it craves it. And without it, you become, delirious, you have withdrawals, or you build up a tolerance. Your psychological dependence with constant use of some psychoactive drugs, strong desire or need to continue using the substance occurs without the evidence of tolerance or withdrawal symptoms. So you may not have the physiological issues, but you have the psychological ones. So you've got pleasant effects and urge or cravings that go with your psychological dependence. Hypnosis, cover that really briefly. That was a deep Freudian thing. Altered state of consciousness, allowing for changes in perceptions and behaviors that result from suggestions, keyword suggestions, made by a hypnotist. Mesmerizing is a term, like when you're mesmerized, something, you're in trance, it seems hypnotic. And that came from, look at his name, Mesmer. 19th century doctor attempts to heal a patient using hypnotic techniques created by him in the 1770s. So it was coined, that name mesmerizing was coined after Franz Mesmer. So some false claims about hypnosis, so I can kind of myth bust. People can be hypnotized without consent. Absolutely not true. You can't just hypnotize anybody. And the person needs to know they're being hypnotized. They agree to this. It's something that, being hypnotized doesn't work unless you consent to it. Hypnotized people will act against their own will. Absolutely false. You cannot be suggested to do something unless it was something that you didn't want to do or thought about. So if I took somebody that was I'm not going to get dark. Never mind. Let's say you're a smoker and you don't want to quit smoking. You like smoking. You know it's bad for you, but you don't want to quit. If you agree to being hypnotized just because, why not? And then I was able to hypnotize you, then it would do nothing because you're not willing to do it in your brain. Hypnotized people can exhibit superhuman strength. No, don't even know where that myth came from. Hypnosis helps people retrieve lost memories. No, it does not. Let me take that back. It can work. It can help when you are dealing with somebody with trauma, that you are kind of getting the surface out, and then you can do hypnosis if somebody is suggestible and is willing, but it's kind of a really dicey kind of area. Hypnotized people experience age regression. In other words, they act childlike. You see that in media portrayals. Not very true. Hypnosis induces long-term amnesia. No. Following characteristics are evident in a hypnotized person: ability to focus intently, ignoring all extraneous stimuli, heightened imagination, an unresisting and receptive attitude, decreased pain awareness, high responsivity to suggestions. And then hypnosis has been used therapeutically with limited success. So because that perception that is seen in media, Hollywood, TV, whatever, that you can just hypnotize anybody, or that if you just do this, it works, when in reality, you have to really be willing to do something for it to work. It's just kind of like a drop in the bucket of help. Theories. Hypnotized people experience a split in awareness or consciousness. Using PET scans, some researchers have found evidence that hypnosis induces changes in the brain that might explain diminished pain perception. Hypnosis is a role-playing exercise, not a distinct state of consciousness. So again, that role-playing has to be give and take. You are agreeing to this, and that is that. So with that said, glad I kept it to about 30 minutes. Go back, look at the things that I said, know, or it's a good idea to know. And with that, I will see you in the next video. And as always, peace.